Dr. Kourakin, it looks like you might have invented or did invent, tell me, a particular crown. Basically, you know, you're a dentist and you're putting crowns on people and crowns break, but you have invented a crown which is called a Klencher Crown, spelled with a K rather than a C. Tell us about that crown. What's going on with that crown?
Well, first of all, Helmut, I've been practicing dentistry for 30 years, and I've done many crown preparations myself. I've seen crowns from patients from all over the world because in the city of Millville, we have many international companies there, Durand International, for instance, there. So I've seen many different preparations from dentists in, for instance, France, Germany, Sweden, Britain, the Ukraine, Russia, and it's interesting to see what technology is out in the rest of the world. I personally am someone who wants to have the most conservative work done in my own mouth and to only perform the most conservative services for my own family and friends. Because what nature has given us is always best. What man does is always second best. That's just the way it is. And therefore, if you think about it, what can I do to a tooth that is in need of some serious repair, and how conservative can I be in treating that tooth? And yet, patients have the expectation that whatever I do to the tooth should last forever. So, keeping these, parameters in mind, I realized that, let's take an old technology, let's take a skill and a dental training there that has been known for years, and now we have the laser technology and the dental imaging technology that allows us to put together a type of a crown that literally is indestructible and is minimally invasive, and I underscore that, minimally invasive to the tooth. That's a win-win situation for the patient and for any dentist there, because we know that once you place one of these appliances in the mouth, it's going to work. You place it, goodbye. Just do your regular brushing and flossing and maintenance of the tooth.
So it holds longer than a normal crown.
Absolutely. We have so many patients that come in that are clenching their teeth, grinding their teeth, exerting too much pressure. There are so many patients that come in and they have teeth that because everyone's tooth is a different size. Some people have shorter teeth. Some people have longer teeth. If you have a very short tooth, you have a minimum amount of room to work when you do a crown preparation, or you may run the risk of exposing the crown, or you're going to place a crown that's not going to stay on the tooth. And we have so many patients that are aggravated that they went to a dentist, they placed the crown, and 2 years later, it's come off. 3 years later, it's come off, and it's got to go back on, and it's constantly falling out. That's wrong. A crown should not come off here. Something was done to over-prepare that tooth there. And this is why we need to be extremely conservative in our preparation so that we do not violate the nerve of the tooth and that we keep that preparation to a minimum, and yet we provide the patient with a material that's going to last a lifetime.
Beautiful. So that's probably very big advantage if let's say a person has a bridge and he needs 2 crowns here and then have that 1 tooth hanging in between, or even 2. If it's more sturdy, lasts longer, then that whole bridge will last longer, and he doesn't need 3 or 4 implants, which saves him a truckload of money, I suppose.
Absolutely. If you assume the cost of an implant to be approximately $3,000, depending on what area you live, a Klencher crown could be done for literally $600, or a bridge, a Klencher bridge could be done for literally $600 less than that. And quite often the adjacent teeth are in need of some service besides the fact that there is a tooth missing in the center. So now you've treated the tooth to the right, treated the tooth to the left, and you've replaced the tooth in the center, and you've done it for far less money. And unfortunately here, at least in our area, we have many patients that have dental insurance where the insurance carrier simply will not pay for an implant regardless. So this is just an incredibly viable alternative.
Beautiful. So without going into technical or clinical details here, how do you go about this, that this Klencher Crown holds better, works better, is less invasive?
You need to be an engineer. You can't just be a dentist. You need to look at line angles, and literally the tooth has to be engineered correctly. You need to understand what a retention form is. In other words, what's going to hold that tooth in place? You know, did you ever take one glass and get a glass stuck in the other glass, and literally without any glue, you can hold one glass in the configuration of the other glass? Well, keeping in mind that if we have the correct form of the tooth that's been prepared by the dentist to act that way, you won't even need cement to hold that in place. You need cement to seal it, but we need this form, this engineered form, to be able to support that crown so that it will never come off.
All right. I think you did give it an explanation which we all can understand. Basically, the planet, the law of gravity, everything, it provides a certain way, an equilibrium, and you find that, and all of a sudden you will need no forces. It just fits and holds better. I got that. So wonderful. Is that something you're gonna?
And it enjoys all the chewing pressure you can give on it. As a
Well,
matter of fact, I tell the patients there, the harder the bite, the better. God bless you. Enjoy.
great. So is that something you have or will be patenting soon here, or what's the deal there?
We've been doing this now for several months, and we've been very happy with the results that we have so far. Whether it's going to be patentable or not, I don't know. I probably won't even consider patenting it there. You know, there's a lot of issues behind trying to protect your patent there. I would just as soon get the word out to the patients, and to the dental community. This is something that is, I think, the best alternative there, because it is so minimally invasive there. So it's as close to what Mother Nature has given us as we can possibly get.
And as you said somewhere in the middle of this video, that anything Mother Nature made is better than what we make. So if we can reconstruct the things which we make at least as close to Mother Nature as possible, then we have it made. What comes to my mind right now is, for instance, an igloo in up there in Iceland or somewhere where there's lots of snow, and there you are sleeping in a house of snow, and you're perfectly warm. Mother Nature provides it.
Absolutely. And it makes me feel so good when I see one of these Klencher Crowns, and I tell the patient, enjoy whatever you want to eat with this. You have no worries there. And to see the smile on the individual's face, it's just such a rewarding feeling.
Beautiful. Well, Dr. Kourakin, very interesting. Thank you very much.
Thank you.